Hello guys, this is Dr. Madhuja Nath. Today we are going to discuss about MCI 2018 and I'm going to give you a couple of information regarding that. So this year 2018 MCI or Foreign Medical Graduate Examination is going to be held on 14th of December. The registrations are already over and it is also like a little less than a month left for the examination. So at this point of time I expect the students have already sorted which subjects they are gonna prepare, if they are leaving some subjects or according to their own. So this is the time you start revising with the subjects which you have prepared all these months, and I hope that all of you have really bucked up and really paid attention throughout these months, and I really hope that you do good in the examination. But few points do remember in the last this couple of days of the examination, that with the stress, dealing with the stress of the examination, I know anxiety strikes, but do get proper amount of rest. And also please don't start with a new subject, because that will just do is that increase the confusion, and that will not really help in the examination. Keep on revising the matter which you have learned in all these months, and if you really think that you have left some important topics, yes, you can give time to important topics, but a whole subject starting right now is not really a good idea according to me. But yes, you people are wise enough, so do according to that. There are certain subjects you can't miss while preparation of your MCI examinations. The major subjects like OBS Gynae you can't miss, because you have 30 marks in OBS and Gynae, and that really holds a lot of weightage. And then according to me, PSM is one subject that you shouldn't be missing, because the questions are quite direct, and even if the questions are a little twisted, like the sums which comes in PSM, if it is little twisted also, with a lot of practice it is like very easy to score in those. There is nothing to go wrong in those kind of things. And then the latest vaccine or any kind of latest informations which are going regarding medicine, like whatever disease or the latest treatment which are likely to be asked in PSM, kindly keep yourself updated, though it is taught in the class or not, because this is a very important thing. It can be easily asked in the examination. Like for example, when I gave examination which was like a year back, I was asked the vaccine for dysentery, or by what time we are heading towards a situation where there will be dysentery will be eliminated. Okay, so these are kind of things, but this was not taught in class or this was not in notes, but these are the things which you have to learn, and just keep yourself updated. You can Google it also, it's not a very big deal. So this, and then in a short subject, as I always say, kindly refer to my previous videos also, because there I have given detailed information, so that will be helpful, like ophtha, ENT, forensic, and anesthesia. Then pharmacology is also a thing which you should know very well, because it can be mingled with any subject and asked, and if you leave pharmacology, it is a very big loss for you, because then many questions will be left out. And then from basic subjects, anatomy, biochemistry, microbiology, and physiology. Physiology is a subject where it is a little difficult to answer because the questions are twisted, but then obviously as a subject you should know it, because these are the basic subjects, and without basic subjects answering major ones becomes difficult. Then pathology is one subject which is very important, and yeah, so these are the things. And if someone asks that can I leave something, see, leaving is not an option, but if you really ask my opinion, then medicine as a whole, it is very difficult to revise medicine 2-3 times. So take topics from it like respiratory system or cardiology, so you can so that you can revise it before the examination. Like I left CNS from medicine because that is little my weaker point, so I left that. So that is according to you. And surgery has 2 parts, so kindly try to do one part at least, systemic or general. So choose according to your convenience and do one part very thoroughly, and other parts you can again choose the topic according to your wish. But if you ask my personal opinion, leaving is not an option. But if you have already left some subject, don't try to grab it out of anxiety right now, because that will not help. So with this I will end this video, and that's all the information I gave. And I know this is a very like composite video with not much explanations, because I have already explained about MCI thoroughly. There is nothing new to be said, and there is no point repeating the things over and over again. That will become boring. So that's it. And like, I'm really wishing best of luck to all the students who are preparing for MCI, repeaters also. So everyone, give the examination with full confidence and pray every day, and I think that you will all come out with flying colors.